Does your low back pain seize up when getting out of bed or when bending forward to pick something up? If so, you're not alone. In fact, acute low back pain is one of the most common causes people face. But there's good news. You don't have to let it control your life. Hey everyone, my name is Dr. Zach Greenwade here at Performance Sport and Spine in Seattle, Washington. In today's video, we're discussing what is causing this sharp, sudden pain, the best ways to provide relief, and how to prevent this from coming back. Stay tuned, we're going to give you this great step-by-step strategies that will make a huge difference. So what's causing this pain that you're experiencing? Well, there's several different reasons. So the first is trauma. Think a fall that causes a broken bone or maybe a really bad car accident. The second one is a structural defect. So think facet changes, a disc bulge or herniation, or maybe ligament damage. The third is mechanical overload. So here in Seattle a few weeks ago, we had this bomb cyclone that put people's powers out, and they had to lift their garage door up. Well, in that moment, it didn't hurt, but that's something they don't normally do, and it's overloading the back. Well, unfortunately, someone woke up the next day or the second day and had their back go out because of the mechanical overload. And then the last thing is a prolonged awkward posture. So this is doing something that you don't normally do, not just sitting weird, or repetitive movements. So again, doing more than your back can currently handle. Some of these causes of back pain are for a single reason, like a muscle strain or a broken bone. But more commonly, it's more about regional irritation. And recent research has shown that high psychological stressors can cause a flare-up of a previous episode. So if you've already had back pain, maybe you strained a muscle playing football 10 years ago, and you go through a new thing, like I had a patient last week that had a divorce and his back flared up. Other things can be losing your job or maybe having chronic sleep deprivation. So sometimes we gotta think about these psychological stressors as well as physical stressors. One thing to note is this video is all about educational purposes. If you have back pain, hopefully you've already gone to a doctor. If not, you should always have a trained healthcare provider assess you. Two terms that are common with this are a slip disc or a pinched nerve. Now first, a slip disc is a misnomer. A disc can bulge or herniate, but it can't physically slip out of place. And a disc can press on the nerve. But this is easy to know if you have or not. If the disc is pressing on the nerve, you're going to have a severe acute pain that's constant down your leg. This is some of the worst pain you've ever experienced. You can't get out of it. It's 24/7. So if you don't have this, you can be highly confident that you don't have a pinched nerve. There are some serious medical red flags that we need to be aware of that may indicate a more serious issue going on. So the first is trauma. Again, that fall that maybe broke a bone or tore a muscle, you need appropriate imaging to rule it out. Second is sudden or progressive muscle weakness. So weakness in the foot or ankle, most commonly being foot drop, which means the muscle that holds your foot up just flops down as you walk. And then lastly, infection or fever. Your pain in the back may be caused by an infection, which is a more serious issue. Number 4 is unexplained weight loss. Have you lost a lot of weight recently and there's no other reason? 5 is changes to your bowel or bladder, especially being able to hold your bladder. And then 6 is a history of cancer. Now these are not exclusive, but these are the 6 most important ones to be aware of. If these are negative and you've seen a healthcare provider and they've ruled out anything serious, what you have is called mechanical back pain. And even though it's some of the worst pain that you've ever felt, it's not medically serious in the sense that it's very painful, but not indicative of damage. Now that we ruled out those medical red flags, there's good news. This paper found that the median duration of back pain for people was 5 days. About 70% improved with 1 week and over 90% improved in 6 weeks. So this does get better even though it's really painful. And the best analogy that I've ever heard is like a grade 1 sprain of your ankle. Anyone that's had this, it's incredibly painful and you have to rest some, but it does get better. So with back pain, you want to do your medical due diligence to rule out the serious pathology. But again, if you have, it's going to hurt for a while. The expectations, you're going to have to rest and go slow, but it will get better. Now we're going to show you this amazing step-by-step what to do each day to optimize your recovery and get you out of pain as fast as possible. Your back is seized up. What should you do for the first 1 to 2 days? It's all about rest and pain management. That tissue is super irritated and inflamed and you want to rest. Use things like heat or ice, ibuprofen or NSAIDs if medically okay, and then elevate it and rest it. Maybe go to the bathroom a few times if you have to, but the ultimate goal for the first 2 days is to let those tissues calm down and rest it. Don't go to a massage therapist or a chiropractor. The more they work on it, the more the pain is going to be there. Again, think of that ankle analogy. When you got an ankle sprain, you got to just have expectation that you got to rest and lay low for 1 to 2 days. This phase, if you can, try to take off work, especially if it's a heavy manual job, and try to ultimately rest, change sporting events. If you're going to fly, maybe postpone your flight. Again, try to modify your life so you can prioritize resting and healing. Now we got day 3, day 4, and there may be some overlap. This isn't exactly the same for everybody, but this is a good kind of platform to build off of. It's called the exposure phase. So now we're going to start trying to add movements in that help healing and reduce pain. So the first thing I want you to do is try to increase your walking throughout the day. Shorter, more frequent walks, not one long walk. So say day 3, you can maybe walk 5 times for 2 minutes, and the pain's there, but it doesn't get worse. Now maybe day 4, you found that you can walk 7 times for 3 minutes, and again, the pain's not getting better or worse, but it's still there. As long as the pain is not getting worse at this phase, it's good. So you want to increase movement and increase function to help things heal. Another good strategy is start to add some bending in to get the spine moving. Now you should probably not go forward, but here's some options to bend backwards. Here's some options to bend to the side. And here's some gentle rotation options. Now again, these are about dynamic movement. We're not stretching. These are not intense. They're very light. At any point, if your pain increases, you need to stop. You have to let your pain at this stage indicate how fast you push. If you push too hard, you're going to pay for it the next day. Moving to the next stage, so day 5 to 7 is the strength and exercise phase. So your pain should be mild, maybe low, moderate. You're getting through your day, but it's still there. It's definitely not perfect. We want to start strengthening the spine. The best way to do this is with isometric, so loading the spine without repetitively bending it. But that's only half the equation. The other half is how intense should I do it? What's a safe dosage? Well, Ben Cormack, this great physical therapist out of the UK, came up with this rule called the rule of 10. And what this means is that your pain plus the intensity should equal 10. So let's say your pain is a 7 or a 6, for instance. That means your intensity, if your pain is a 6, should be 4. It helps you kind of dose it when it's more intense. Well, let's say the next day you're like, wow, I'm feeling better. My pain's only a 3 now. Well, now you can increase the intensity of these exercises to a 7. Because sometimes when you do these exercises, you'll do them too intense and you'll say, well, it doesn't hurt in the moment, it must be safe. But with this, you have to make sure that it doesn't hurt now and it doesn't hurt worse the next day. And this rule of 10 can be a great gauge to kind of make sure that you don't do too much or too little. Supine bridge hold. Lift your hips up with your glutes and hold at tolerance. Hip adduction ball squeeze. In a supine bridge, place a ball between your knees and press in and hold at tolerance. Hip abduction. In a supine bridge, place a band around your legs at your knees, press your knees out and hold at tolerance. 90-90 hip hold. Bring one leg up into a 99 position, resist with your hands isometrically, hold at tolerance. Wall anti-rotation isometric. In a split stance, place both arms against the wall, press into the wall, hold at tolerance. Plank. In a knee or full plank position, lift, engage your core and back, and hold at tolerance. Now we talk about back pain prevention, as about 30% of people will have a reoccurrence within 1 year. And the best way to do this is with consistent aerobic exercise and strength training. Research shows us that people that do about 300 minutes per week of moderate exercise or 75 minutes of vigorous exercise and strength training 2 to 3 times a week have a significantly less chance of having back pain than people that don't. So even though things like chiropractic or massage or acupuncture may calm the pain down, nothing helps prevent it like exercise and staying healthy. 3 things that we should highly recommend you do, as they're very functional, is a lightweight goblet squat, a deadlift, and then a suitcase carry. These are things that help strengthen your spine for day-to-day life, so that when you do something, their back is prepared for it. It's not out of the ordinary. Thank you so much for watching this video on acute low back pain. We gave you a step-by-step guide to help you manage it all on your own and really help it prevent it from coming back in the future. If you like this video, please like it and subscribe to our channel, and then don't forget to check out our other amazing videos.